first off to Gary Blau, the branch chief of the Child, Adolescent, and Family Branch at the Center for Mental Health Service at the Substance Abuse and Mental Health Services Administration.
All right, that was a mouthful. I don't know. Hello, everyone. I am Gary Blau, and thank you for joining us. And first off, let me begin by saying congratulations. All of the folks that are on the call today applied for and were awarded one of our System of Care Expansion Planning grants, and it's very exciting. And I don't know all of the folks that are on the phone, but I do want to say I'm really excited that we have planning grants now all over the country, and this cohort, you're now part of a new cohort of planning grants, and it includes folks from the Northeast, all the way up in New Hampshire. I hear people down south, all the way to Florida, including parts of Maryland, and as you go down the the East Coast here, we have Mississippi, and then all the way starting to go out west, Ohio and Missouri. I don't know. I assume our friends from Boston and Massachusetts are on the phone. And outwards towards Montana, our colleagues at Box Elder at Rocky Boy Health Board. So I'm just really excited about all the folks, and then perhaps maybe not on the phone today, as we have to find ways to connect with them, is the territory of the Commonwealth, actually, of Saipan. And it adds to yet another component of this program that it really does serve states, local jurisdictions, cities, towns, counties, as well as tribes and territories. And one of the things that I think that the Children's Mental Health Initiative, which we all refer to as Systems of Care, has done over the years is to really create a diverse program of activities where we are literally trying to spread the values and principles of systems of care all over our country. And as folks will see as they participate, and I'm hoping many of you certainly know all about systems of care anyway, and what you'll learn from the people that have been doing this work for a long time is that systems of care really have changed the way that children's mental health services are delivered in the country. And getting ready, and the idea behind this planning grant is that folks have a concerted year, an effort here of specific planning dollars to do lots of things. And I guess it's now that I've congratulated you, I think now it's probably my turn to put a little anxiety in there, because you know what they say, a little bit of anxiety is actually good for you. Too much is bad and too little is bad, but a little bit is good. So a little bit of anxiety because you have a lot of expectations in this next year to develop a solid set of plans to implement, to get ready to implement a real system of care in your locality. And so hopefully you're going to hear today from lots of folks that are here to help you. And that's really the key to systems of care, is that because we have all of this technical assistance and because we have folks here to do evaluation services to see what's working and lessons learned, there's great information available. So our goal, as our first slide is going to say, I guess that's my slide, I'm going to click forward here. Our goal really is to spread systems of care across the country and really through our states and communities, tribes, territories, and the District of Columbia, is to find ways to develop, to create the plans across a host of areas that are critical to us. So for example, the development of infrastructure. And one of the things that folks are going to start talking to you about is what is the necessary long-term strategy and sustainability strategy to create infrastructure that will support a long-term approach to creating mental health services that we hold near and dear. Obviously, the service delivery component to that is also important, and the kinds of services. And that's what we're going to be talking about here today, is to get folks ready I'm hoping folks are already moving forward, but to get you ready to really do this job. A little bit about SAMHSA here. For those of you who don't know, SAMHSA is actually one of 12 operating divisions of the Department of Health and Human Services. So if we were together today, I would ask you, does anybody know, I don't know, maybe there's like this audience participation section here. I see there's presenter chat. Presenters, no, I don't know if there's one. Everyone, there's a chat. Does anybody know who our current Secretary of HHS is? I try to have fun with these webinars, by the way, because everybody's sitting here listening. But somebody write down, who is the current Secretary of HHS? And we're waiting, it's coming to us. But so everybody's trying to think. It's Secretary Burwell is our current secretary. Anyway, as I digress, SAMHSA is one of the 12 operational divisions of HHS that include things like the Centers for Medicare and Medicaid Services, the National Institutes of Health, Administration of Children and Families. SAMHSA is actually the second smallest. That's my other trivia question, which is, what is the smallest operational division of HHS? But SAMHSA is the second smallest at a budget of $3.6 billion a year. And we have evolved now into 6 strategic initiatives. We used to have 8, and now we have 6 that are now good for the next several years that we've been working on. Prevention, healthcare and health systems integration, which is something that we'll be doing a lot of. Trauma and justice, which is another area that this program works on. And recovery support, which is certainly something that we are. So we really do touch across a lot of these strategic initiatives. Health information technology, and then finally workforce development. And I mention this for several reasons. One is to give you context about SAMHSA. The other, however, is that as you move forward and look for additional service dollars, if you're coming to SAMHSA for those dollars, that these are the strategic initiatives that we're going to be focusing on. All right. Importantly, SAMHSA operates on what we like to call our theory of change. And the theory of change begins with, and I think it's important to us because the systems of care, the values and principles, the program itself that reflects the systems of care values and principles really has been a definition of this theory of change, where we have started as an innovation, looking at a concept essentially, and then moved that forward through the use of our demonstration programs, through the use of our various policy initiatives, along with disseminating this through technical assistance and the like, all the way to this idea of expansion of and implementation to wide-scale adoption. And that's actually the reason that we are trying to create these planning and implementation grants that we did several years ago. At that time was to try to help folks to move from an innovation, which was systems of care many years ago, all the way now where we are seeing the wide-scale adoption of the system of care framework, the system of care approach all over the country. And now we're trying desperately to try to help people to implement that and to keep developing that. So as you can see on our historical perspective slide, you are now joining a long-term movement in children's mental health that started back in 1984 with the Child Adolescent Service System Program, or CASP, that then expanded through 173 different awards from 1993 to 2010 that had put a lot of different systems of care programs, if you will, on the map. And now, since 2011, we've been awarding our expansion planning and these expansion implementation grants. And you can see the numbers on there. And I think the message here is that there are many, many communities across the country, tribes, territories, et cetera, that are doing this work and doing it well. You can see from the slides, and we like to call it dots on the map. You see a lot of these dots on the map over the years in terms of our original Children's Mental Health Initiative Awards. These are the 173 that we had. And we decided at one point that really the critical piece was not necessarily to put more dots on this map. It was actually about finding ways that the larger jurisdictions and large cities and communities would do the approach, would create the approaches to systems of care that would be sustainable. Because it's really not sustainable for us to just keep giving, these dollars out for different grant programs. Although it's nice, after a period of time, the grant monies, go away. The feds don't keep, ponying that up forever. And so really it's about what can we do to expand this work and sustain this work. And that's where these expansion planning and implementation awards came from. And as you can see from this new map for the expansion planning and implementation awards, we are putting more dots on there, but with a new purpose, which is to try to get folks to think broader. Think about, if you are really trying to develop financing strategies, who are the right players to be at the table, the colleagues that we have in other child-serving, systems and financing systems. One of the things that we've talked about for a number of years now is as we're moving forward with our planning activities and to try to support you, our real goal is to transform the work of children's mental health in your jurisdiction. And that really does, and we created several years ago this idea of a transformation equation. What does it take to transform? What will it take for you to take your planning efforts and ideas and broaden them and get other people to buy in? And so the transformation equation has guided our approach to systems of care planning and implementation for a number of years. And it's a pretty simple one, V plus B plus A times CQI squared. Alrighty then. And for those of you who are wondering what that means, I will tell you. First off, it's a function. Transformation is a function of, number one, the vision. Vision is important because it provides a direction for the work that we do. And it's really important as we go forward that your constituency groups, and I say this in a broad way, depending on what your focus is, but the idea, and the idea really is that our stakeholder groups, our constituency groups, as I like to call them, have to have the same kind of a vision. A vision that, again, is providing that direction. And then we have to add to that beliefs. Now, our beliefs are listed on this slide, that our belief system has to do with family-driven and youth-guided care. Our beliefs focus on cultural and linguistic competency, evidence-based practice, and clinical approaches. That our program incorporates all of these kinds of I guess activities, but it's really about values into the work that we do. So while we embrace an entire continuum of services, and that includes peer support and young people and engagement and involvement, and it incorporates specific issues related to culture and the values that are inherent in that. And it also is about implementing evidence-based practices and trying to incorporate those pieces that work and that we have research on. And some of that may be preliminary, or it may not be adapted for a particular population. So we need to use our clinical skills and engage the folks that do clinical work, social workers, psychologists, psychiatrists, physicians, all of those folks that are involved are necessary. And then vision and belief really doesn't do anything. It's just rhetoric unless you add to that the A, the actions. What will be the specific, and this is what your planning grant is all about, what will be the specific actions that you're going to develop in terms of your plans that you can then implement, whether or not you get another grant. I mean, that's really the key here, because we can't all determine that. And then we multiply this idea of vision and belief and actions by continuous quality improvement squared. And we say this because CQI, or continuous quality improvement, if nothing else, really is about feedback mechanisms. It's about getting input and getting information about how this works from our constituency groups, from our providers, from our policymakers, and especially from our families and our young people. And we square it because that feedback is so important, because it goes back and drives your vision, your beliefs, and your actions. So for example, 25 years ago, when folks started to talk about family involvement in systems of care, we have evolved that based on CQI, because we don't talk about simple family involvement anymore. We talk about family-driven care. 20 years ago, we didn't have any kind of ideas about young people being engaged, or even providing services, or offering their own opinions about services and systems. And now we have a national youth organization, which is represented here on the phone today, Youth Move, Youth Motivating Others Through Voices of Experience, that has expanded this idea of youth voice. So we've learned from this, and now Youth Move, in addition to being its own national 501c3 nonprofit organization, has 77 chapters across the country. And so those are the kinds of things that we do as a movement and as a values and principles, and that we have learned, our lessons learned, that has been a CQI approach that has really reconceptualized what our vision, our beliefs, and our actions are. And all of this doesn't work unless we really are focusing on what it is that we want to provide for services. This is probably the most important slide that I will have for you today, and that is in May of 2013, SAMHSA, along with the Centers for Medicare and Medicaid Services, issued an informational bulletin called The Coverage of Behavioral Health Services for Children, Youth, and Young Adults with Significant Mental Health Conditions. I will urge you, this is a 9-page document that we hold as our Bible for service delivery, because what it says is that CMS is supporting the system of care type of services that we hold so dear. Wraparound approaches in terms of intensive care coordination, parent and youth peer support services, very critical to the work that we do. Respite, in-home, intensive in-home, mobile crisis, the use of flex funds. And this is all in addition to the traditional clinical type of service delivery that we also provide. Now, for me, this is a context for us, because if we are not taking advantage of the idea that Medicaid is supporting our services and will pay for them, perhaps through the use of a waiver component, which folks can learn about, or other mechanisms, then we're not doing the right job to sustain systems of care. We also have CMS coming out with a final rule on home and community-based services. And so you should download these. I think you'll probably all get the slides or whatnot, and use them. These are the kind of things to talk to your Medicaid directors about and your policymakers about. You know, we need to ensure part of our sustainability plan is to be able to bill Medicaid for these services. We're also engaging with commercial insurance companies that are also interested in doing work to develop and implement these kinds of services. So the idea here is, number one, is that creation of infrastructure, because if you don't have people that oversee, that do the work of coordinating and stuff, then you can't sustain it. So you got to find ways to sustain those activities. Some states have done innovative things. They've created a director of systems of care, or a position that actually monitors this kind of stuff, or a training approach to do that. And at the same time, it's about the development of service delivery models and the financing of those that actually gets you to the end game, which is providing the help that young people and their families need. The other thing as part of this project that I think it could be a component of both infrastructure and service delivery has to do with the linkages and connections that we expect and hope that you develop. Whether or not that you're working with these third-party insurers and financing things, it's also about reaching out to your colleagues in child welfare, juvenile justice, primary care, substance abuse, education, all of the folks that touch the lives of our kids that need to be connected, because otherwise we're not doing that system of care, kind of approach. It's really interesting, and some of you may know this, but many of our systems of care that have been funded are sustained not just because of dollars being infused, they've also been sustained because our other colleagues, our other systems have ponied up. Juvenile justice is a great example. We have several sustained systems of care because the judges have stepped up to say, we want these services, and they can pay for them because they're redirecting young people away from residential services into the community, and therefore they take those dollars and they help to sustain systems of care. We're also focusing on lots of different populations, especially varying transitions, whether it's early childhood into school age, our young adults. As adolescents transitions, we have our new program called Healthy Transitions that came out of the President's last budget. Now is the time. So focusing on particular populations is also a way to engage our constituency groups and better link with them. So as you can see, these are the drivers, the way in which that we really want to have folks, pushing their envelope as part of the system. So Anyway, that's my broad overview. We have so many awesome folks that are here to help you, whether it's our technical assistance centers at University of Maryland and all of their partners, whether it's Georgetown University and their partners. We have our evaluation folks. I think Westat is joined us today. They're our national evaluator and developing strategies to learn lessons from what you've done for planning and what our former grants have done for planning, and now our implementation grants and what's happening with them. We have our family organizations that are participating. I know the Federation is on the phone, and our young people. I know our youth move connections are on the phone. And we also focus on specific issues such as our tribal grantees. We do a lot of work to engage varying cultural groups, and so we have the National Indian Child Welfare Association that's part of it. And all of these folks, just as a reminder, are here to help you. You know, we're not here to bother you. We're here actually to offer our assistance in any way that we can. I mean, we do our best to provide expertise. We do it together. This is like a mutual learning experience. And all I would ask you all to do really is to focus your efforts on you know, what's going to happen next, expansion and sustainability of this work, because that's why we're putting this investment in you. And then the last thing that I want to really talk about is the importance of your connections with your government project officers. We have a whole host of GPOs, as we call them here, government project officers, that work in the branch that are your direct link to anything, that if you have questions about stuff, they are your go-to folks. I will remind folks that they are the only ones that can actually make final decisions about certain issues or help you navigate our complicated, you know, grant systems and approval processes and whatnot. So please make sure that you connect on a regular basis. And in fact, as I shift gears, one of our fabulous government project officers, Deborah Cady, is going to take over for me now to talk specifically about the role of the government project officer. So I wish you all the best. Please contact us if there's anything that we can do to help, and I'm sure that we will do our best. And Deborah, it's turning over to you.
Thank you, Gary. And welcome. My name is Deborah Cady, one of your friendly and helpful GPOs, Government Project Officers. We have several project officers here in the Child, Adolescent, and Family Branch, and each grant award is assigned a GPO, and you will find that on your notice of award. If you haven't been in contact with your GPO, I would suggest give them a call. I have all of the numbers for all of the GPOs at the last part of my slide set. And we are very excited to welcome you to our new family of planning grants, and we really want to start a partnership with you. So what do we do as a GPO? Well, we manage programmatic aspects of your grant. We know that you wrote this grant a while ago, and we also know that things could have changed since you've written that. You might have different partners, you might have different circumstances, changes in government and people. We're here to work very closely with you around providing guidance, helping with strategic planning, problem solving some of those various grant issues, or even stakeholder concerns to help you reach your project goals. Sometimes there are needs of your community, key stakeholders who have concerns about the grant, and we like to work with the community partners and with you to find mutual ways to solve those types of problems and issues. And then we want to listen to what your needs are and make sure that we are helping to identify your training and technical assistance needs, and then to connect you to this huge, wonderful network of providers and contractors that you're going to hear from throughout the rest of the webinar. We also help with making, like Gary said, kind of some final decisions on what we can and cannot do. And if you're experiencing a certain type of difficulty, we probably have experienced that in another site. And so what we want to do is to connect you to peers in other states or communities who've had similar problems, or they're targeting a similar population that you're working with. And so we just really want to make sure that you have the resources that you need for your strategic and sustainability planning. And we also like to have regular contact with our project staff there And we might do that on a monthly call. It could be a webinar, emails, meetings. Perhaps we're all going to be at different conferences, and we can meet with you there. The bottom line, though, is that we have to make sure that we are monitoring progress and compliance along with federal regulations. And so in that particular area, what we do is we review your progress reports and the evaluation data. We like to determine if you're on track, you're making progress. We provide you feedback on your reports and provide opportunities for you to get into compliance if you have gotten off track. We do conduct site visits for other grantees. The one-year planning grants do not get a site visit. However, the way we have structured our GPO assignments are that many of us have several grants in one state. So if we do arrive in one particular state to conduct a site visit, don't be surprised if we stop by and have a little chat and meeting and meet with you about how you're doing. The other thing that we do is if there is any change in your key personnel listed on your grant application, which is in your application, it's on the checklist, which is the second to last page of your application. Part C, it asks you to list two names. One is the business official, and then the other one is the program director / program director / principal investigator. And so if those two names have changed, it's really critical that you provide us information, update that checklist. We review resume, and then we take that information and recommend that to our grants management. The other thing that we do is if you're looking at trying to do some budget revisions, change in scope of work, continuation applications wouldn't be relevant in this particular case, but no cost extensions, we are the first contact that you want to talk through what you're wanting to do. And then based on that, we provide a programmatic recommendation to our grants management for approval of that. So when you think about the other part of monitoring the grants that you have, we have the grants management office. And so we work with them to make sure that you're in compliance. Your grants management specialist is Gwendolyn Simpson, and she is responsible for all administrative and business matters related to your grant. I put her information here on the slide, and whenever you are communicating with Ms. Simpson, you must reference your grant number in any communication. So in the subject line, you must put the grant number. There's literally hundreds of grants that come through their office, and they're not going to be able to track that to a question you have with the grant that they have. So please do that in any communication. And I also think it's a good idea for you to CC your GPO in those emails, just in case we can work together. And we work together very closely with Gwen around getting your questions answered. And remember, it's always better to ask questions up front than to find out you have a problem later. And so there's a grants management webpage that I've provided for you there. The other thing that we do is, obviously, actually what you need to do is certain reporting requirements. I think the first idea for you is to carefully review your notice of award and see if there were any terms and conditions attached to that and any deadlines that have been identified for you. If you have any questions, again, that's Gwen Simpson, CC your GPO, and if you have, like I said, let's get these questions answered right away and keep you in compliance with those terms and conditions. You know the final product is at the end of this planning period that you will have a comprehensive strategic plan, and that will be your final report. You do have another biannual report that's due April 30th for the first 6 months of your program, and each of your GPOs has a template that you can use to complete that report. And then we also have another reporting requirement. I'm not going to go into TRAC. You probably have heard the Transformational Accountability Reporting System. That's our current system, but we are migrating to Common Data Platform. That's CDP. So you're going to hear more about that. They're rolling that out, and you as new grantees will not start entering into that data system until it's up and running, and you will be getting emails from our contractor around that. And it's really important for you to engage all people in all training so you're in compliance with that. And finally, just a summary. We really want to work with you closely as a grantee to strategize and provide programmatic guidance. We want to work with our technical assistance contractors to help you access those training and resources, and work with our evaluation contractor to help monitor your progress, and of course your grants management specialist to make sure that fiscal and grant compliance issues are addressed. And so I think it's a huge partnership. You have a big team behind you to help you be successful. So stay in contact with your GPO and let us know if you have any questions. And that's the contact information. If you have the slides set, you can find those numbers. We're also listed on your NOAA, and I'm now going to turn it over to Beth Stroll.
Thank you very much, Deborah. I would like to do an overview for you of strategies and tools that can support your work as you get started and also on the way during the planning year. Many of these have already been emailed to you and have more detailed information, and also I believe you'll be able to download this presentation later. So my role will really just give you an introduction to some of the concepts and some of the tools that will guide your work. And I wanted to start with some baseline questions about expansion planning. One, how can your planning lay the groundwork for implementation? What's a strategic framework that you can be using? What lessons have been learned by previous planning grantees that can inform your work? And then again, what some tools are available for you? To start with, in terms of the process overall, I wanted to emphasize that planning is the first stage. It is not an end in and of itself, but it really is just laying the groundwork for implementation. And continuity in the process is really a key to success. So it's essential that you look at this as a continuous process, and whether or not you receive an implementation grant, you will see the planning phase as part of a process that leads you to implementation later on. The other key concept that I wanted to mention to you is that this planning grant has been awarded to some of you who are state jurisdictions or tribes or territories, and others are to local jurisdictions or regions that are undertaking this planning work, as Gary mentioned. But we've learned through experience and also through some of our research that both planning at the local level and systemic changes at the state, tribal, territorial level are essential for implementing, sustaining, expanding systems of care. So your planning process should look at that from the very beginning. And whether you're a state grantee or a community grantee, there needs to be a partnership established early on and strategies that are implemented at both levels together and collaboratively to achieve both the systemic changes we need at the higher levels of government and also the implementation work that we need at the community level. There is this logic model, which may be difficult to see, but you can look at afterwards, which reflects those two concepts. One, that this is a continuous process of planning and implementation, and two, you can see that throughout it reflects that there will be activities and strategies and outcomes that occur at each of these levels, the state, tribal policy level, state, tribal, territorial policy level, the community level, and then also outcomes at the child and family level. So what is a framework that you can use for system of care expansion? Actually, what I like to define a system of care as is pretty simplistic. It's a range of services and supports supported by an infrastructure and guided by a philosophy. So when you're trying to determine what is it I'm trying to expand, I think in a nutshell this is what it is: services, infrastructure, and philosophy. And we did some research a while back and looked at states that had already made significant progress toward expanding systems of care. And what we identified through that is 5 core strategy areas that are important to create those changes needed for widespread expansion of systems of care, or really for any kind of innovation in health and human services. They are all overlapping, they're interrelated, but what they amount to in these 5 areas are policies, services, financing, training, and generating support with strategic communications. So those are the 5 areas that when you are creating your plan, you need to look at in terms of what you need to achieve in each of these areas to reach the goals and objectives that you've established for expansion. I am not going to go into the details here, but I'll tell you a little bit about each of the 5 core strategy areas. You can see in policy, we're talking about a place where the buck stops there, a locus of accountability for systems of care and interagency structures. One of the most important things here is requirements, and it really is a combination of requirements and incentives, but requirements in contracts and in rules and regulations and standards have been a very key element of the implementation and expansion of systems of care in states, and so that's been incorporated into many of the plans. Expanding services and supports, and Gary mentioned this, it's looking at what the array of home and community-based services is, and also the individualized wraparound practice approach. Those have been 2 of the major things that states and other jurisdictions have concentrated on, as well as family-driven, youth-guided, and care coordination, care management. And as Gary mentioned also, the services mentioned in the joint bulletin are some of the ones that the planning and implementation grantees have concentrated on. The next area is financing. I just want to point out a few of these. Medicaid, as you know, is the primary funding source for behavioral health services to children, youth, and young adults. And it's been a strategy that many states and communities and other jurisdictions have concentrated on in their planning process. And it is an essential element. And so in terms of financing, that's one area that it's important for you to concentrate on and explore what the opportunities are. Block grants are often used, we have learned from an environmental scan, that are used very frequently to fill in services in areas that are not covered by other reimbursement sources, and also redeploying funds from higher cost services like deep end placements in residential or inpatient or PRTFs, redeploying funds from those to lower home and community-based services, which, by the way, tend to have a much stronger evidence base from the evidence base for services like residential treatment. So financing it is an important area. The next one is training and technical assistance, and we found that that plays an important role in educating the providers, the administrators, all of the levels of involvement in systems of care, the agencies that share responsibility for this group, but not only providing training, but also creating ongoing training capacity, like an institute or a center or structures and processes that can, on a longer-term basis, continue providing training in the areas that are needed for systems of care. Many of them focus on individualized care, wraparound processes, and evidence-based practices. So the capacity is equally important as providing training yourself. The 5th area is around generating support, and social marketing or strategic communications is a vehicle that our grantees have been using for that. An important component is looking at your family and youth organizations, who often are the keys to generating support, particularly on high-level policymakers. And what we found is that this is one of the most critical elements in your plan and in your implementation. And of course, throughout, it's infusing our values into this planning. Just briefly, to use this strategic framework, it's important for you to look at what your overall approach is. Are you going to do it geographically, add counties and regions over time? Are you focusing on an age band, the most high-need children? And then you specify your goals based on that approach, look at what your core strategies are, and you can use a process like this to take each of your goals, look across those 5 strategy areas, and specifically put down what you must do in each area to accomplish that goal. Couple of lessons that we've learned from previous expansion grantees. We did an analysis. Stakeholder involvement went well. TA went well, so take advantage of TA. It's important to have strong management and leadership for planning process and effective planning structures. And they have found that having a team and then subcommittees that can deep dive into specific areas was really an excellent strategy for them to use. Some of the challenges: startup takes a long time, and you need to recognize that the planning grant is a year. It's a short time frame, compressed period, and it's difficult during that period of time to accomplish everything that you would like. So planning ahead to address the challenge of knowing that you only have a limited amount of time to do this. Some of the recommendations from the grantees are around the process: have a team, have subcommittees, engage families, youth, and young adults from the beginning of the process, orient everybody on your team so everybody has a common understanding, first of systems of care, which our grantees reported not everyone did, and also your goals. And an important one is realistic goals and concrete strategies. Getting too pie in the sky doesn't get you where you need to go. You need to be realistic. What can I accomplish? And concrete strategies for doing that. And as I already mentioned, high-level commitment is one of the keys to success of your planning process, but also implementation. Staffing. There were some challenges in our earlier planning grantees around this. They found that maybe hiring, which takes a long time, may not be the ideal way to go. We want to make sure that the process is integral to the system, so you may want to consider internal staff and also consultants who can help you with coordination and writing, but hiring may not be the best approach. Also, as I mentioned, work plans with very specific timelines in terms of the short time frame that you have to complete this work. So here are the key elements of key to successful expansion. And the one thing, if there could be one important takeaway from this isn't a project. This is sustainable, systemic changes to improve services and outcomes and expand systems of care. So I don't even like to hear it referred to as a project. This has to be integral to your system and a part of infusing these activities throughout the child-serving systems. I want to close with mentioning just a few tools. You, again, have already received some of these by email. It came from Georgetown and are available at the TA Center at Georgetown site. There is the strategic framework that I already described, but you can have more detail about that and how it's applied. There are some planning tools, a guidance, a template, and some others. There's an implementation guide, which you may not need right now, but it would be a good way for you to prepare for implementation. And 2 tools that I want to mention to you. One is a strategic, an assessment of system of care strategies, and this is based on that strategic framework that I just went over with you, gave you an overview of. And this has been used by as a readiness assessment, the one that you're required to do. Many of the planning grantees have used that for this purpose, and it can be done as a group exercise or having multiple stakeholders do it and tabulating their results. This isn't an evaluation. It's a tool that you can use to see what areas you've already made progress in and what areas that you might think about working on in your planning process. And the other tool that I wanted to mention to you is a rating tool for system of care development. And this really is intended to assess the progress in implementing the approach at the community level, which of course is your goal. You're in a planning process for expanding systems of care, so ultimately what you want to know is, have I accomplished that? Have communities in my jurisdiction actually implemented systems of care? So we developed this instrument specifically for this purpose. We operationalized some of the system of care elements around the values and the services and the infrastructure with various indicators that can be used as benchmarks. And you can then derive both an overall estimate of the level of implementation in a particular community from a 1 to 5, and you also can look at the various elements and their indicators to identify strengths and areas needing improvement. And some of our jurisdictions, particularly the implementation grantees, are using them at intervals to assess progress and to evaluate what's happening either in individual communities or across multiple communities in their larger jurisdictions. And there are some detailed reports that are generated. This is something that may apply later on, or something you might want to consider as a baseline assessment, and then can be used over time to assess progress. So those are some useful tools that you can think about, and you can get more information about them by contacting me, and I think the contact information is at the end of the webinar. But also there's information about these tools on the website, and we are in the process of creating some toolkits that will put all of these tools together with some instructions and guidance as to how you can use them and how you can get some help in applying them in your states, your communities, your tribes, territories, jurisdictions. So with that, I'm going to turn this over to Melissa, who's going to talk about the planning processes and considerations in tribal communities. Melissa?
Thanks, Beth. I am Melissa Bob. I work for the National Indian Child Welfare Association. We're a national organization, and we're located in Portland, Oregon. We do a lot of work around the country on child welfare as well as children's mental health and research. And here we have a team of 3 people that focuses on technical assistance for tribal systems of care communities. So in my mini presentation here, I'm just going to introduce our team and the previous tribal planning grantees and our approach and some things to look at moving forward. So these are the previous tribal planning grantees. We have people in Alaska, Wisconsin, Washington, Nebraska, California, Connecticut, Michigan, Oklahoma, and New Mexico. And many of these communities receive Circles of Care grants, and the Circles of Care I've listed on the top of that slide. That is a 3-year planning grant for tribal communities to look at what's going on in their communities, do an assessment, look at the resources, and then develop a plan. So many of these communities have already done that, and then they have the planning grant, and then many of them have already moved on to do the implementation work. So we provide technical assistance, which really just means we're resource people for the community. So I'm from the Lummi Nation in Washington State. We're right on the Puget Sound next to Canada, and I did this work in my community for a few years, and I work with Twyla Begay, who is Navajo, and she's new to our team. She has a Master of Social Work. I have a Master of Public Administration and Tribal Governance, and we also work with Linda Goki-Rindal, who is Ojibwe from Wisconsin, and she does a lot of the work with the youth, so she specializes in youth engagement. So we have a broad team with a lot of different expertise, and then we connect communities with consultants that have more specific expertise. And so that's part of our role. We also do site visits to focus on the community's priorities that they identify. We do monthly individual calls with communities, and we have all grantee calls and webinars. So those are monthly, and the tribal communities receive emails about that, so we're adding all of the new communities to our email list. So we use the relational worldview TA model, And it basically means we understand that change is constant and we can identify patterns in change. So we have this image here, and you can use it as an assessment tool for an organization. There's also one for individuals. So looking at how all of these different pieces are interrelated and they influence one another when you change them. So it's not a linear approach. So we're looking at the bigger picture, and then these are the different elements for systems change. And then tips for tribes, we really encourage that communities start developing the relationships internally and externally. So they're informal and formal leaders. Many of the things Beth mentioned earlier are applicable to tribes. The policy changes, the technical assistance within your community of teaching people about the system of care. I think the tricky part is translating it into the language that your audience can understand. So there's social marketing technical assistance that can help you with that, help you with your messaging, and we can also help with that. So that is my presentation, and you can reach me via email or over the phone, and we'll, I think, be following up with contact information. So the next presentation is Kathy and Mario talking about cultural and linguistic competence. Thanks.
And actually, I'm pinch hitting today. My name is Catalina Booth. I am the Executive Director for the Center for Community Learning. And together with the University of South Florida, that would be Mario Hernandez and Kathy Lazier, we are the CLC hub for the TA network. And today I'm going to give you a brief overview of the issues of cultural and linguistic competence and what resources are available to you. As Gary stated, cultural and linguistic competence is a key component of the transformation equation. And it's important to understand the key issues of cultural and linguistic competence. And there are three of those. First, the issue is whether behavioral health care is appropriate. What we mean by that is whether behavioral health care is responsive to health beliefs, language, customs, and other cultural factors. The next issue in this field is disparities. And the question, what we mean by disparities is whether there are differences in outcomes and conditions among specific groups as compared to other groups. And the main factors that we look at that lead to these disparities and the reasons these disparities still exist is because there's unequal access, treatment, and services. So a lot of our technical assistance and webinars and toolkits and materials that we will provide you will help you address those disparities, will help you identify them, and then address them. And then the next issue in this field is the issue of disproportionality. And sometimes these two terms get confused, but what disproportionalities actually is whether there is over or underrepresentation of a particular race, ethnicity, or cultural group in a program or system compared to the representation in the general population. So for disproportionalities, you'd be comparing apples to apples. Do I have more apples than I should in this particular program as compared to the entire basket of apples? Which is different from disparities where you're comparing the apples to oranges. Are there more apples than oranges in this fruit basket? So those are two things that we will be helping you look at and address as you begin your planning and begin doing your reports. So how do you address these issues? How do I address the issues of appropriateness of behavioral health care, disparities, and disproportionalities in behavioral health care? Well, we have here a list of things that you should look at and you should address in your planning. First is that you should have committed leadership and resources to the issues of cultural and linguistic competence. Secondly, you should use data to inform your decisions. And then as you create your leadership and your resources, use data to inform those decisions. Next is something that we will talk across in the different fields is you should have meaningful involvement of key diverse stakeholders, whether that's youth or families or both or other minority groups. Include them all in decision points throughout the process. The next important component to address cultural linguistic competence is creating a strategic plan that includes a behavioral health disparity impact statement and class standards. And I'll talk to you a little bit about the resources we can provide to you in these two specific areas when we get to the next slide. The next area that you should address in terms of implementing and cultural linguistic competence is looking at your policies and procedures, your mission statements, definitions, and all those guiding documents, and making sure that they reflect the values of cultural and linguistic competence. Do I have a definition of culture? Do I have a definition of cultural and linguistic competence? Do I have the methods and the means to achieve those goals? And do I have them in writing in a concrete way that I can achieve them? That's what you want to look at. Next, you want to make sure that you provide ongoing training and skill development so that you can have a diverse workforce. You want your volunteers, you want your employees and your participants to all be diverse, and you want to provide them the skills necessary to do the work. And that goes with the next one, which is ensuring that any certification you provide, licensing you provide, or any contracts that you do as part of this grant or as part of your work meet standards that are culturally and linguistically competent. Next is that as you deliver services, that your service delivery strategies are culturally responsive. You want to take a look at those and address any needs that there may be there, and to ensure that service delivery strategies do not become a barrier to entry and continuing of services. And last but not least, you want to conduct evaluation and research and data activities to do and make sure and check yourself to make sure that you really are implementing a plan that is culturally and linguistic competent. So that's a lot to do, and that is it may seem like a daunting task, but you are not alone. There are resources here for you to rely on. First, you have the Cultural Linguistic Competence Hub of the TA Network. We have created for you a library, an online library full of resources for eliminating behavioral health disparities. They are focused on giving you practical implementation tools as well as background materials in all areas of cultural and linguistic competence implementation in children's behavioral health. There are budgets, forums for having a cultural and linguistic competence coordinator, to toolkits on how to provide language assistance. So that's a great resource, and the link is provided there in the slides, and you will receive a copy of this presentation with the link. We will also, the CLC Hub will also present webinars. For example, next week we have our first webinar of this fiscal year, which is it's the first webinar of a two-part series on class standards implementation, how to implement various aspects of the class standards into your system of care. And this first one next week on October 22nd is how to implement health beliefs into your organizational structure to create a more responsive system of care that addresses disparities and disproportionalities. And the second seminar would be November 5th. And then throughout the year, we will have more webinars. And another way the CLC Hub can provide you with direct assistance is learning exchange phone conferences on a monthly basis to discuss key areas. And you'll receive communications mainly through the TA Telegram that will give you information on how to join those calls. The next resource you have available to you is technical assistance through the TA Network. We have a variety of TA Network core partners and consultants that can give you technical assistance in the area of cultural and linguistic competence, whether it be for a specific population group or for a specific aspect of your planning, such as your behavioral impact statement. In addition, you have two online-based resources available to you. One is the website for the Office of Minority Health, and the other is the website for the National Center for Cultural Competence. So I know that's a brief and quick overview, but we are here to support you and help you in any way you can, so please feel free to reach out to us. And now I'll turn it over to Sandra Spencer and Jane Walker, who will talk about family organization and leadership.
Hello, everyone. As Gary Blau said at the very beginning of this call, one of the values of a system of care is that the system is family-driven. As part of the you will have access to two partners, each of them family-driven organizations. The first of which is the Federation of Families for Children's Mental Health, led by Sandra Spencer, who will be chatting with you in just a moment. The organization is the family-run Executive Leadership Association, or FREDLA for short. I am Jane Walker, the director of FREDLA. Both the Federation and FREDLA can provide your state or community with technical assistance in different making your system family-driven. This might include recruiting and partnering with families, connecting state family organizations, strengthening or rebuilding existing family organizations, or possibly developing a new family organization. Family organization become a member or the family partners in their organization to become certified. So there's a wealth of information available to you, but now I'm going to turn the presentation over to Sandra Spencer from the Federation about the concept of family-driven care.
And welcome. I'm again Sandra Spencer, Executive Director of the National Federation of Families for Children's Mental Health, and I just want to review a little bit for you family-driven care. So we've developed a definition of family-driven which says that families have a primary decision-making role. It means that they have a role in the care of their own children, but this is a larger systems level because they also have a primary decision-making role in the care of all children in their community, state, tribe, and the nation. So this means that as far as your planning grants are concerned, you need families that are helping you make sure that your plan includes families being able to choose culturally and linguistically competent services, supports, and providers. And we just heard a lot of our past presentations. Families need to be right there with you as you set goals around this planning activity. They need to design, implement, and have strategies for evaluating those programs that you're planning for. And they also should really be involved in how you're going to monitor outcomes. Helping you set goals, but they really are helping you set the parameters in which you're going to make sure those goals are met. And then families are involved in planning decisions, really being able to let you know what programs, services are most important for families, what works, what doesn't work, so that families can really be onset in your planning activities. So what needs to be done when you're doing your planning? You need to make sure that family voice is there from the very beginning of your planning process and then beyond. So you really need to make sure that you're connecting with and building partnerships with organizations. There are family-run organizations all across the country in state level and local community and county. We really want you to connect with an existing family-run organization to really get started with your planning activities. Ensure that your planning and family voice is in what we call the lived experience. And these are families who have already raised children, who've been through multiple systems, such a wealth of experience in doing this, as well as make sure that you involve families in a part of your planning who are representative of the population that you're focused on. So, for example, if you have a planning for 0 to 5 or early childhood, you really want to make sure that you have those families involved as well. and also the families with the lived experience who will help mentor them and really help them participate fully in your planning process. You also allocating enough resources to continue to support your family involvement. It is really important that families feel validated and compensated for their time and their expertise. And then you really want to make sure that in your planning process that you are setting policies and procedures to ensure that all members of the planning team understand fully the importance of family-driven of having families involved. These policies and procedures need to be written in your plan so that everyone can see them and can implement them. And so now Jane is going to give you a little bit around how to connect with the National Federation and FREDLA.
Thank you, Sandra. On this slide, you see for both the Federation and FREDLA. Each contains a wealth of information pertaining to family involvement as well as family organizations. In addition to the you'll also be getting a calendar of webinars that are co-presented by both Federation and FREDLA. And we are very happy to be part of providing technical assistance and hope that we can be a resource for your community or state in the coming year. Turn it over to Johanna Bergen from Youth Move.
Hello, welcome everyone. My name is Johanna Bergen and I serve as the Interim Executive Director with Youth Move National. We are a youth-driven advocacy organization which supports the work of Youth Voice across the country, and MOVE stands for Motivating Others Through Voices of Experience. We work to unite the voices and causes of youth across the country and use our experience to create positive systems change. We also provide and support technical assistance to our Youth Move chapter network, which is located in 37 states across the country, and are proud to be a partner of the TA network, where our team is able to provide technical assistance to support the infusion of Youth Voice into your system of care planning work. Throughout this webinar, we've talked about the values of system of care, and I'll remind you again about Youth Guided and let you know that we believe and System of Care believes that Youth Guided means to value youth as experts, respect their voice, and to treat them as equal partners in creating system change at the individual, state, and national level. One thing that I want to talk to you about today is how you can ensure that Youth Voice is present at the table in your community as you begin this planning process. Just like a business doesn't ignore the needs of their customers, how are we as communities engaging our customer base, the youth who are receiving services and need the support of our system of care? How is Youth Voice directing the work of the system of care? We can do this work and ensure that Youth Voice is at the table by inviting young adults to the planning table from the very beginning of our work. As you do this, you'll look into your community and identify if there are young adults who are already involved in this type of work or who are ready to be involved in your planning work. You could look for a local Youth Move chapter, a youth advocacy organization within your community, look to family organizations within your state who may already be supporting Youth Voice, or look to advisory councils and youth groups who remain active from other system of care funding throughout your state. If you are able and have found Youth Voice and young adults who are willing to participate in the process, then you can move forward in your planning process to sustain that Youth Voice and that youth involvement in the future. If you look throughout your community and do not identify current Youth Voice, then you can plan for it. And we have learned that we need to intentionally develop space for youth involvement. This might look like creating advisory positions on committees and work groups. A young adult advisory council will be a fine place to start. And then with a council that's created, how would you work to infuse the Youth Voice from that youth council across all of the work that you do? We have learned that youth meeting in a vacuum does not affect positive outcomes. And so we challenge you to think about, and we're here to support you in the work to infuse and integrate youth and young adults in all of your planning work. We need to create intentional space throughout our process to listen to young adults. This needs to be worked on in concrete ways, and youth voice and youth involvement will not happen by accident. Inviting and engaging youth and bringing them to the table is a necessary first step. We want you to engage young people who reflect the population of your community. It's important to reflect and to look across your community and make sure that our young people who are speaking at the table reflect and represent the voices of the young people that we are supporting. And again, we must plan and be intentional about engaging young people. There is a developmentally appropriate way and ways to engage youth, and this starts with the invitation. It's going to look different to engage young people in your community than it will look how you engage other key stakeholders. And the changes and the differences will begin with the invitation and reaching out to young people and explaining what you're doing and what their role might be. And the intentional engagement and the appropriate strategies will continue through how you support young adults, through meetings, through planning processes. How you engage and facilitate feedback from young people will look different than other key stakeholders. And the engagement of young people continues past our meetings and oftentimes needs to increase intentional debriefing processes and support for young people to process and engage after a meeting or planning process has completed. One of the tools that I direct you to look at and consider to use as you establish where your community is in youth engagement is Hart's Ladder of Youth Involvement. This is an example of a resource that can be available to you through our technical assistance. The rungs move from the bottom of youth engagement, where we do not want to be, with manipulation and tokenism. This is not reflective. These rungs are not reflective of youth-guided system of care values. Your community may already be higher up on the ladder, consulting and informing youth of your work. And our question will be to you in your planning process: how ready and able is your community to involve youth? What do you need and what supports need to be put in place to move your entire community up the ladder of youth involvement? With all of the components of system of care being laid out for you today, it can be helpful to think about what youth engagement might look like in your community in the coming year. This might include including youth on committees and work groups, and you could set an expectation from the beginning of the year that youth will be at the table at all times. Perhaps your community will conduct a needs assessment, and at this point there is an opportunity to engage young people in both crafting the questions of an assessment and are they reflective of youth voice and values, and also carrying through and working with young adults to the end of your needs assessment, where young people actually help you analyze the results using their unique lived experience and youth lens to help you better understand what you have discovered. A good place for all communities is to start by assessing your community's readiness to support youth voice. And this can start, again, by finding out if there are current youth voice organizations that already exist in your community who are ready and willing to partner with you. And if you are a community that finds that there are not ready and willing youth organizations, then the place to start will be how to prepare your community to support youth voice in the future. A community should identify a team member who can serve as a coach and a mentor to young adults who are invited to participate in the committee's work groups planning process throughout the coming year. It's important for young people to have a stable and reliable contact that doesn't continually change, so they have a support structure and someone to go back to ask questions about and to debrief. In the work of system of care, it often feels as if we are talking about abstract and intangible concepts, a challenge for us all, and especially a challenge for young adults when we initially engage them. What is system of care, and how can they be involved and be an important part of it is a hard concept to grasp. So it can be a good first step to find a concrete process to engage young adults in. This, and I've shared two examples here, holding listening sessions where you might host an event similar to a town hall for a system of care leadership to hear directly from many young people in a setting that's safe and comfortable from them, or involving your young people in your community in planning and crafting the message for Children's Mental Health Awareness Day activities are two examples of how to bring the system of care experience into a concrete and tangible platform for young people. After you engage young people in something that has a concrete end and start to the process, then you can invite young people and ask if they will be interested in continuing to be involved in your planning process. And if so, how do they see them fitting into that process? Youth Move National will be available throughout your planning year to provide youth engagement resources. You can request support through your calls with your TA coach. Resources are available to be disseminated to you, and Youth Move National will be here to help with your more in-depth needs. Some of the ways you'll be able to receive technical assistance throughout the next year include inviting a team member or members who will be supporting Youth Voice in your community to join a community of practice of others doing similar work across the system of care community. You can join webinars that we'll host throughout the year, and you'll be notified through the TA network on topics of interest and support for the work you're doing to engage youth in your community. And we facilitate peer learning because you can learn from the opportunities and experiences your fellow system of care sites have had over the years. And you're not alone, and assistance is available to you in engaging young adults throughout the year. And we look forward to engaging with you in many ways. I'm going to pass the webinar presentation over to Anna Maria and evaluation.
Hi, folks. I'm happy to be here. I'm Anna Maria Brannon, and I'm serving as Principal Investigator of the National System of Care Expansion Evaluation through a subcontract with Westat, who holds the primary evaluation contract, and I'm at Indiana University. I am delighted to be representing the many partners that we have across the country and across organizations, and I'm pleased to be able to do that. I also want to point out that on this slide you'll see there are two ways that you can contact us at any time. These are live. Both the email and the telephone numbers are currently live, and feel free to use them. Well, the primary aims of the evaluation are to take a look at the extent to which planning and implementation efforts actually reflect and embody system of care values, result in a really genuine spread of systems of care in the many ways that grantees conceptualize that. We're also interested to see whether over time, what the nature of those inter-sector collaboration at the top administrative levels are, and how they might change. And we want to see the extent to which system of care practice at the service level. We're focusing a great deal on mechanisms and strategies for implementing and expanding systems of care. As planning grants, you will be participating in our jurisdiction level assessments. And by jurisdiction, we want to make clear that we just mean the largest geographic area that will be covered by the grant. So it could be a state, could be a territory, could be a tribal area. It could be a region of a state, a mental health region of a state. However, the grantee conceptualizes that geographic area. And we will be describing systems of care and how they're organized and how they're planned, and identifying mechanisms and strategies. And we'll use document reviews, stakeholder interviews, and web-based self-assessment to do that. The stakeholder interview is really designed to create a description of what is going on in the jurisdiction to build and to implement a system of care. So when we talk to you guys, folks, we'll be talking about your plans and how you're going about the planning process. We will be using a semi-structured interview, and it's based on a conceptual model and framework that's purposely developed. The self-assessment of implementation, while a description, the self-assessment of implementation is more of an assessment. So we will be documenting the strategies and mechanisms that are used and assessing the extent to which they're found to be useful and effective. And it allows us also to assess system of care development over time. The survey will be web-based, standardized enough to be able to make it is standardized enough to make comparisons across grantees as well as over time, but we will tailor it to make sure that we use language that's used in the jurisdiction for certain services, certain organizations and agencies. These two are designed to complement each other. Assessment implementation survey was developed conceptual framework that we use for the stakeholder interviews. I also want to say that as planning grants, you'll have an opportunity to be able, because you probably won't be in full implementation, you might get some implementation done before your funding's up. You the opportunity to report whether or not you're planning to use it, what steps you are in the planning process, and whether or not you've had any opportunity to implement any of that. So right now, we are entering our second year of the evaluation. In the first year, we spent a great deal of effort working very closely with the Federation of Family, Youth Move, many consultants, several organizations to develop the tools that we were going to be using. And we are now in the process of pursuing approval from the Office of Management and Budget to utilize the tools. The Federal Register notice is posted to an opportunity to comment on our tools, and we're hoping that and wishing fervently that in February, late February, we'll have approval and we'll be able to start data collection. We've developed a site liaison system so that every grantee has a site liaison that is their first point to have an evaluation question or to interact with the evaluation. Those folks are actually on the phone right now and listening, and they will be contacting you in the next 6 to 8 weeks. Around that time, we'll also do an introductory conversation with you to get to know you, understand how you're organized, the role that organizations and youth are playing, just getting to understand how you're going about the work of expansion. And we'll also at that time try to identify some documents that might be useful for our evaluation and make some requests. And back to you all. Social marketing. We'll be discussing social marketing.
Thanks. Hi, this is Jane Tobler with the Caring for Every Child's Mental Health Campaign. We are delighted to be here, and congratulations to all the grantees. The Caring for Every Child's Mental Health Campaign offers social marketing training and assistance, technical assistance to you. So you may feel a little overwhelmed by all the material and information that you're receiving today, but trust us, you can call any of us and we can guide you in the right place. So the first question is, what is social marketing? Some of you may be familiar with the term, some of you may not use it often, but it is part of the requirements of your grant, and social marketing is a process that applies marketing principles and techniques to create, communicate, and deliver value to influence behaviors that benefit society, as well as the audience. And as you heard from Gary and from Beth and for all the esteemed people who went in front of me, we are really trying to affect change. We are looking at transformation. And transformation doesn't happen overnight, and it doesn't happen without really influencing attitudes and behaviors, specifically around mental health and children's mental health and behavioral health, and that of our young people and our young adults as well. So, that's a little bit of background in social marketing. It's also that you are creating, communicating, and delivering benefits that an audience wants in exchange for audience behavior that benefits society without financial profit to them. So obviously, we are not selling something that they're giving us money for, but they are giving us a different way of thinking, a different way of believing. And again, we're really looking to influence behaviors and attitudes to truly ensure that system of care values and principles are infused throughout your area. So it's very important, and Beth hit on this earlier, that many sustainability strategies benefit from social marketing, and that includes the cultivating strong interagency relationships, which I know you're probably working on and you did to even apply for the grant, involving stakeholders, establishing a strong family organization, using your evaluation results, and creating an ongoing focal point for managing the system of care. These are all really important pieces that will absolutely help you in the long run, and it's all things to kind of consider and the importance of using social marketing and engaging in social marketing. So one of the things you want to think about is right now, today, you, your staff, the people who signed on the line to get the grant with you, where does each group stand? Where does your staff stand on the continuum of understanding and on the values and principles of system of care? Do you feel like the people that you're going to be working on for the expansion year, are they unaware of the systems and values of system of care? Do they, which is all the way to the left, the blue box on the left, do they have an understanding, just a basic understanding? Is it a little more than that? Are they interested? Do they want to learn more? Are they fully supportive? You really want to think about each audience that you're working with and that you're at the table with and where they fall, because you need to know that in order to figure out how to get them to the next blue box and what you need to do. You know, if you've got people who are totally unaware, then maybe it's worthwhile working with those who want to learn more or are fully supportive so they can help move your system of care forward. So what do you need to do in expansion planning, especially around social marketing? One of the questions is, what are we all about? What are we here for? You know, you've got the partners that you signed up with. You need to bring them together and figure out who you are and what you're doing and what you're trying to do in this first year. And that involves getting together your key staff, your key partners, the key people, could be your CLC people, young youth members of the family. Who are those people and how do you get them together on the same page and listen to them to figure out what is important, and then start to really think about how do you describe what your system of care is, because again, in order to change attitudes and behaviors and truly make transformation, everyone has to be on the same page and be able to describe it in the same way. So you want to get everyone together and ask questions. You want to ask, what is our system of care all about? Who is part of it? Why does it matter? And that's maybe one of the most important ones, is why does it matter? Why are we doing what we're doing today? Why are we trying to do this? What are our values and why do they matter to youth, to families, to funders, to partners? You're going to need to figure that out and be able to really write it down and agree on it. What actions do we want or need others to take? And then what will be better? Why are we doing this? What's going to be better as a result of our work here today? How is this going to make the world a better place? And of course, we just heard from our evaluation people, you know, what's the data that we have either to support it, or what's the data that we need to support it? You know, that we need other people. You know, when you think about those blue boxes, if they're legislators that are people that you need to affect change, you need to know, where are they in the blue boxes? What do they believe in? Because for them, it is going to be important to have that. And then this is the social marketing process. I'm not going to take you through the whole process today, but it is important just for you to see, and you'll see it again. You'll be able to talk with your social marketing TA providers later, but there is a whole process we go through. And thinking about, for right now, for today, where do you start? First thing you do is you identify your experts. You mine existing resources. That can include grantees that have gone before you in that space. It could be through people who have done social marketing, maybe not in your geographic area, but they've done it for young adults, or they've done it for 0 to 5, or who it is. Test your ideas out, make sure that it's working and you're on the right path. Put together a social marketing plan and then learn and adjust. Maybe they'll say this is the right thing, maybe they'll say it's not. I would also say one great opportunity for you is to participate in Children's Mental Health Awareness Day. This year is October 16th. And it is, I'm sorry, did I just say it? Oh, May 7th. It's October, surprise, it's today. Wouldn't that be a surprise? It's not October 16th. This year it is, that woke everybody up, right? This year it's May 7th, and it's really a great opportunity nationally that everyone is celebrating this. So it's a great opportunity for you to leverage your local partnerships and to go and get them on board and say, hey, let's do something for this really important cause. You know, what can we do? And that's a really good way to sit down and then get them to be those partners that you really need to sustain and to expand.
Finally, here are a few of the social marketing TA resources. I know that you'll have the slides so you can go back to them, but we do have a listserv. We have the ECHO program. We can see what other people have done for various audiences, KSOC TV, and various tip sheets and resources. And finally, you should contact your social marketing TA provider. And the TA providers, we are a partnership with NashBid, Vanguard Communications, the National Federation of Families, and also Youth Move National. And so those are the TA providers. You may have already heard from them, or you will in the future. And we are excited to work with you. Please do call us, and if you don't, we will call you. So thank you very much. I appreciate your time, and now I will introduce you to Jim Weltering. Jim?
Hello, thank you, Jane. Good afternoon, everyone. Congratulations. I'm going to be as quick as I can because I know we're running over our time here. Do you want to keep going, Michelle?
Yeah, you and I can just round it all up, Jim.
Okay, good. What I'm going to do is really just highlight some of the faculty we have here at Georgetown that will be available to you to work with you. It can be a phone call around a strategy you're thinking about trying, or something more complicated, like a coach who's going to be there with you to support you throughout some of your system change planning and strategy. So the folk I have here all been involved in implementation of systems of care one way or another, and they're about implementation and some of the challenges around that, and can help you with your planning around that. So myself involved at a state level with children's mental health, at a local level, probably specialize more in change management, Medicaid, finance, outcome measurement, and management. We've got Catherine O'Grady, who's a child welfare expert, a former judge, actually was a system of care judge, who can help you with 4E or child welfare issues or juvenile justice issues for sure. She's got years of experience. We have another person, Vivian Jackson, and she specializes in cultural and linguistic competence, and she's to help you with your planning in that area. Sherry Peters comes from Pennsylvania, a children's administrator there, and actually has done a lot of work on reducing the use of psychiatric residential treatment beds, has worked in trauma, and I use her a lot with myself around financing issues. We just hired a new woman, another children's administrator from the great state of Georgia, and she'll be here to help you with your system of care expansion planning, quality improvement, quality assurance are a couple of her areas of expertise. I have Gary Macbeth, who's been here for a number of years, was a former director. He's also from the great state of Virginia, former children's administrator, specializes in health reform, system of care expansion, and actually helps run a Medicaid learning community that we have going on. We have Neil Horn, who's going to be working in the area of special area of early childhood. Of course, you've already heard from Beth with this, and who produced a number of those documents I mailed out to you, a month or maybe it was a couple of weeks ago, to help you in your planning. That Beth wrote a number of those with other folk here, Sybil and Joan, who are retired now. And then finally, I want to mention Gwen White, who specializes in working in the area of youth and young adults of transition age, and has actually been the leader of 3 different SAMHSA grants herself, and comes from the great state of Pennsylvania. So that's a quick summary of my folk. There's a couple of slides for you with our phone numbers, emails, if you want to just email or call me, and I can help you sort through who may be of assistance to you from you. That's fine. And then I just talk about some of the areas I already mentioned that we provide training and TA in. So I'm going to hand it over to you, Michelle. That was as quick as I could go.
I think you did a great job, Jim. So my name is Michelle Zabel. I'm Technical Assistance Network. You have a number of slides from us, but let me just say the TA Network is a group of 11 really, including the University of Maryland organizations. Many of the people have presented on this webinar today, and we really look forward to working with you. We work collaboratively with Georgetown as providing direct to the grantees for SAMHSA. And what I want to make sure you know is that you've already, I'm going to skip to the very end of the slides. What I want to make sure you know is we have a number of
consultants who are part of the TA network beyond the organizations listed in the previous slides. We have about 150 individuals across the country in all of those areas. And the goal of the network was to deepen and broaden the amount and speed by which grantees could receive technical assistance. We know that these are very difficult times, that people are trying to keep up with a lot of activities on their plates, and we want to just make sure that our technical assistance is precise and responsive to you. And so you have, at this point, received a letter from us that includes your assignments from your social marketing technical assistance team, from your either Georgetown or TA network coach, as well as your technical assistance support coordinator. And so I'm going to ask you to do a couple things as the what's next of this webinar series, which is to fill out the doodle poll that came in your letter so that if we have not already had a call with you, we can organize that and start creating an individualized plan for you. All of your TA providers will be on that call along with your government project officer, so it'll be you to really for us to hear from you and for us to begin to work with you over this next year. Additionally, you've been given a state and community information exchange, which is really our chance to hear, prior to getting on the call, how you want to receive TA, what your priorities are, how we can best be of assistance. So if you haven't filled that out already, please fill that out for us quickly, and we'll get this set up and going with you, which we're really looking forward to. The last thing I want to say is that the way to get up-to-date weekly information from all of us is by signing up for the TA Telegram through our listserv. And we've given you the link to subscribe. We've also sent out a link for you to disseminate to your community. So please do that as well, and that will keep you in touch with all of the folks who've presented today, so that you can be receiving weekly information, connected to your resources, and moving forward on your grant. So we are over time. I thank you all for sticking with us. And if you could get those doodle polls filled out, we will talk to you individually. Thank you.